A virus known to cause vomiting and diarrhea is on the rise in Canada. And in Toronto, public health says there's one active outbreak of norovirus in the city. There have been 4 outbreaks in Toronto so far this year. The agency says the numbers have not reached pre-pandemic levels yet. The virus is typically transmitted through bodily fluids, saliva, vomit, or fecal matter. Toronto Public Health is recommending frequent hand washing and disinfecting. Okay, let's discuss this a little bit more with Dr. Allan Grill, Chief of Family Medicine at Markham-Stouffville Hospital just outside Toronto. Good morning, Dr. Grill.
Good morning, Tony.
Feel like I haven't said this word in a while, norovirus, but I certainly remember it well. We were talking about it a lot in the years before the pandemic. How do you describe the level of infection that we're seeing right now?
Sure. So when we talk about norovirus, a lot of people actually refer to it as the stomach flu, although it has absolutely nothing to do with influenza. And we do typically see it, as you mentioned, between November and April. And we see a lot of this in family practice when patients come to my office. It causes an inflammation of your stomach and your digestive tract, and you get vomiting and diarrhea, your tummy hurts, and you feel pretty yucky. Now, the thing is, it's very, very contagious. You can get it from eating contaminated food, or if you touch surfaces that are contaminated and then you sort of put your hands in your mouth, like kids do that a lot. And we do see a lot of outbreaks. You can see it in nursing homes, schools, daycares, cruise ships, even restaurants. The good news is that we haven't seen as much over the last 3 years because of all the pandemic precautions, social distancing, people being very cautious around other people. And you recover quite quickly. When you get this virus, usually you get the symptoms, but within 1 to 3 days, you've recovered. But people can get dehydrated. So I think the key message is to know what do you do when you get sick and when you should seek medical attention.
Now, I don't ever remember this being considered a public health crisis, though, Dr. Grill. And is that because just of what you said, it typically resolves pretty quickly and there aren't really any effects that linger from it?
So, I think public health gets involved, especially considering it's so contagious and you can get, one person gets it and it starts spreading it around. So, if a daycare has an outbreak, it's reportable. If something happens in a hospital, it's reportable. And public health often gives advice on how to manage those outbreaks. But the thing that's really important is that if young kids or older seniors or people with compromised immune systems get norovirus, it can actually be really detrimental to their health. And it's really important to tell people that get sick to drink lots of fluids. You can even buy these oral rehydration fluids. Pedialyte is one example for kids. It even comes in popsicles because that tends to be better tolerated. You have to wash your hands really, really well, at least for 20 seconds with warm water and soap. It's much better to use that than the alcohol hand sanitizers to sort of kill the norovirus. And you want to make sure that you're washing your hands well before you prepare food, after you use the washroom, or if you change a diaper. And again, when you're in your home, wipe down those high-touch surfaces like light switches and doorknobs. Stay home if you're sick, sort of stay away from your family members, and don't share towels, that sort of thing. And finally, if you have someone that gets really sick, like if you have a young child who's not feeding well, or their number of wet diapers is lower because they're not actually, going to the washroom as much because they haven't taken enough in, or you can't rouse them, they're really, really tired. That's where you have to seek medical attention with your family physician or sometimes even the emergency department.
Do you suppose it's always going to be around in our winter virus mix, or is there any way as a society that we can move away from the level of norovirus infection that we see?
So norovirus is one of those viruses that's just kind of out there. It's like the common cold, influenza. It tends to be seasonal, like I said earlier, from November to April. And it's one of those things where we know what it is. The question is, how can we prevent from getting it? And I'm in medicine, so we wash our hands all the time throughout the day. And we try to tell our patients, it's just a good practice. Make sure you wash your hands, especially before you sit down to break bread with people or you're preparing food, that sort of thing. Hand hygiene is absolutely key. And again, if you happen to get this, you want to prevent it spreading to your household or other people. So again, staying home when you're sick, making sure that you're drinking lots of fluids and seeking medical attention if needed. But it's something we're going to live with. And again, these public health measures have served us well for centuries. Let's continue to follow them so we all stay healthy.
Okay, some solid advice, getting back to basics. All right, Dr. Allan Grill, Chief of Family Medicine at Markham-Stouffville Hospital. Appreciate your time. Thanks for being with us this morning.